Hi, everyone. This is Saqi Malik Cho. I am the Director of Research Policy and Health Promotion at the National Center for Health and Public Housing. And I'd like to thank everyone for joining today and for the conference organizers for allowing me to present my research. This has been quite a learning process trying to get this video together. So I hope that we make this all the way through, and it has to be brief. So if you have any questions for me, please feel free to reach out to me afterwards, and my contact information is on the last slide. So the title of my research is Mental Health Status and Service Utilization Among a Sample of Public Housing Residents, Guidance for Public Housing Primary Care. For those of you that are not familiar, the National Center for Health and Public Housing provides research, training, and technical assistance, outreach services to federally qualified health centers that are located in or immediately accessible to public housing. So in 2019, there were 433 FQHCs that provided care to around 5 million individuals that lived in public housing communities. And there were 108 public housing primary care health centers. Those are health centers that receive special grants to care for public housing residents. And those provided care for around 850,000 individuals. So while we do have a lot of data on the patient population that visit a health center, there is not as much national data on mental health and substance use disorders among public housing residents. So, and even less about their use of services at community health centers. So the goal of this project really was to gather that information to help inform the behavioral health services programs at PHPCs and health centers. So our major findings were that, as you might expect, yes, there was a higher prevalence of mental health conditions among public housing residents, significantly higher need for information services treatments for behavioral health conditions. And for those individuals that were trying to get information and were not able to, or trying to get services and were not able to do so, the challenges included fear of asking what others might think, not knowing where to find information, asking for help and not receiving it. So this project really underscores the importance of HRSA's Health Center program as an important and trusted source for behavioral health services, and underscores the need for them to provide that information. So just taking a step back, some background information. There are around 2 million individuals that live in traditional public housing. The majority of those households are low income, have low educational attainment. They're headed by single moms. They are more likely to have elderly members or members who are disabled. So as you might expect, there are a lot of social and environmental and economic challenges that these households face, such as housing affordability, housing stability, housing quality, as well as crime and safety and poverty and racism and all of these factors that take a toll and impact on not only the physical health, but the mental health of the population. So to identify all of these challenges, we fielded a 31-item survey at the National Alliance of Resident Services in Affordable and Assisted Housing Conference, NARSA for short. For those of you who are not familiar with this group, most of the attendants include either public housing resident leaders or housing affordability stakeholders. And so resident leaders are these individuals that serve on their resident advisory boards or the tenant boards. They are highly engaged individuals. They act as a liaison between the community and the housing authority. They communicate issues and information. They provide outreach services. So they are very much aware of the needs and challenges in their community. And here are the things that we asked them. We fielded we distributed 300 surveys. We got 160 back, 53% response rate. I can't go into detail about all of the findings from the report, so I'm just going to focus on the mental health metrics. And as you might expect, as I said before, individuals with housing or rental assistance were significantly more likely to have fair or poor mental health, anxiety, and depression. But take take a look at these numbers. They're quite high. The general adult population, self-reported depression, anxiety is around 20%, and here you see it's around 70%, much higher. And I know this is a small sample, but it's a small sample of really engaged individuals and active individuals. So it's a concern. And then the other issue is that they're more likely to report hardship for depression. So what that means is individuals that have feelings of anxiety and depression are more likely to report problems in just doing daily activities, daily tasks, like taking care of themselves and their others in their households. So individuals with housing or rental assistance are also more likely to visit a physician and get medication or counseling for their mental health issues. And they're also more likely to seek out information on mental health. Around 42% said they were looking for information on mental health and substance use disorders, compared to 13% of those with no public assistance at all. And for those individuals that were having issues with getting information, you can see that 28% said that they asked but did not get the help that they wanted. So that's a big challenge as we try to improve the trust in the providers that are giving behavioral health services. Addressing that issue at community health centers is very important. And while only 17% of individuals that took the survey said that they go to a community health center to get their care, over half of them said that they do think that their local community health center is a good place to access this care. So there are a lot of opportunities for health centers to provide care. Obviously, a need for information, a need for services, and a need to address these issues. I know after COVID, a lot of health centers moved from providing in-person care to providing telehealth services, particularly for behavioral health services, so that that in itself is an additional challenge for public housing residents who may need access to broadband services, and also might have need more assistance in improving their digital health literacy. So I can't go into more detail here. I know we don't have any time, but I would really like for you all to please reach out to me if you have any questions. And here's my contact information. I'd like to acknowledge members and staff of the NARSA conference for allowing me to field this survey there and for being so supportive and generous with their time. And then also to my colleague, Dr. Jose Leon, for his help in gathering this information. Thank you again. And if you have any questions, please feel free to reach out to me or visit our website. You can download the full report.